Can we now shift to Vivekanand Eye Institute, Vivekanand Netralaya for that case? Yeah, Dr. Mansi, can we have the microscope feed?
Yes, sir. So I am tilting the microscope.
Yeah. Can you center it a bit?
Yes, I'll just tilt it first.
Yeah. So you have completed the phaco?
No.
Okay.
I'm doing the KDB first.
Okay.
The case is 53-year-old male with known case of glaucoma. Left eye phaco plus bang is done 1 year back. He is very well controlled IOP in left eye. On examination, he came back for follow-up with the right eye increased IOP, that is 60. And left eye, it is well controlled 16. In right eye, it is not even not controlled even with the systemic anti-glaucoma drugs and 4 topical anti-glaucoma drugs. Pre-op right eye IOP is 29 after mannitol. This is the perimetry picture of the patient, right eye and the left eye, and the disc picture of the patient.
Okay, so I'm trying to focus the angle for you. Island allo system, you can see. No. So
tilted the microscope 15 degrees away and also turned the patient 15 degrees towards you. Is that right, Dr. Mansi?
Yes, 35 degrees, sir. I follow 35 degree. I have a mark on my microscope, which is already there. I tilt my microscope, then I tilt my patient's head, and as you can see, is it visible there?
It is, yeah. We can see the angle structures very clearly.
Angle structures. There are fine iris processes there. It's an open angle glaucoma. And he came to me last year, and I did a bang for him on the other eye. And he was on 4 drugs in this eye, and now we have planned this eye. Okay, so after visualizing the angles, now I'm going to take my KDB inside. So this KDB, it is also known Ilon system. It's Kahook dual blade goniotomy, and it has got a special structure. You can see it has got a tip which is very sharp. When we press it on the TM, it enters the TM, Schlem's canal, and as we move the blade, the TM gets stripped off with the help of those 2 parallel blades on the ram. As I'm deroofing the Schlem's canal, you can see fine blood streak, and this action it's called gliding action. That's why it is also known as KDB glide. You can see this TM strip over the tip of the KDB blade.
Yes, we can see very clearly. And how many degrees do you strip the trabecular meshwork?
So I usually do it 4 quadrants. Just I think Ilon I need to put inside. Four to 5 quadrants or clock hours.
4 to 5 clock hours, you mean?
Clock hours, 4 to 5 clock hours.
Just one question. You said in other eye, left eye, with bang you were able to achieve very good result. So any specific reason of doing KDB in this one?
Yes, sir. Because in bang, you get this, you're cutting the tissue actually.
Okay.
And sometimes you can even structures adjacent to the TM, like the iris root, we can, just
Damage them.
injure
There can
it
be
and
collateral
damage it.
damage. Yeah.
Okay, now I have removed the TM strip. I make the patient straight. I straighten my microscope. Sorry, the view will be not there for a few moments. I'm just centering it. It's Zeiss Lumera 700 has very good optics. And now you can see it's a posterior subcapsular cataract. There's some TM lining. We'll remove that at the end. We proceed with the surgery. So this was a surgical Schwann-Jacobs gonio prism, and it gives an en-face view of the nasal angle. When I would like to thank here my mentor, Dr. Sunita Dubey. She's not here. She was supposed to come. I learned this MIGS from madam in a workshop almost 1.5 years back. And we have been doing bang and KDB here at our hospital since then and getting amazing results. As you can see, this patient with very high IOPs, and now his IOP for the past 1 year without any drug, he's an exceptional case, is only mid-teens, 15, 16, if I remember. Yeah. Just a wash cornea.
Dr. Mansi, I think you mentioned that the IOP in this eye was 60 millimeter of mercury.
Yes,
and
sir.
so with that high pressure, what will be the efficacy of KDB in this patient? How much IOP
Exactly,
reduction
sir. When we did his other eye, we were not expecting this. That with a simple bang procedure, he'll be off the medication. But for past 1 year, he has been off medication and his IOP is well controlled. So I did first, initially when patients come with this high pressure, I usually plan a trab.
Yeah.
I usually plan a trab, but because he has given us such good results with bang, so this time I thought let us do a better procedure, maybe KDB, with more predictable results than bang. So that's why. And the other eye has shown us good results. That's why we have gone with the mixed procedure quadrant. And this is a Zeiss-sponsored session. We are going to implant epinucleus. We are going to implant Zeiss CT Lucia. It's a beautiful lens, and especially in my patients where I plan MIGS or my diabetic patients, I prefer Zeiss CT Lucia. Zeiss CT Lucia, it has exceptional properties of being heparin coated. So any eyes where I'm expecting more inflammation or we expect a lot of sometimes post-operative hyphema from the angle structures. So this heparin coated keeps the optical surface of the IOL very clear.
Because
Thank
of
you,
the
Dr.
paucity of
Mansi.
time,
I think
so
we'll have to close
yeah.
it down, but it was a very wonderful demonstration of not only KDB, the view was so clear, very nice, and very nice done phacoemulsification surgery also. But we'll have to cut it short because we have to end this session as inauguration is shortly going to start. Thank you so much. And thank you everyone at Vivekanand Eye Hospital.
Thank you AIOS. Special thanks from Vivekanand
Thank you so very much.
To give us this opportunity. Thank you. And we are very much, excited.
I think Dr. Sunita will be greatly honored by seeing the skill of your surgery.
Oh, yeah. Thank you. Thank you. Thank you, Namrata ma'am, especially Dr. Gaurav Luthra sir, for giving us this opportunity. I hope.
All the very best. Okay, bye-bye. Bye.
Thank you, sir. Bye-bye.
Bye.
Let's take the lens.